The first COVID-19 vaccine may reach San Diego County by next week. The push for patience as cases surge going into the holidays. Plus, running short on ICU beds, local hospitals turn to new methods learned over the past 9 months to help healthcare workers at risk of being overwhelmed. It's an annual tradition to bring cheer to local military families. We look at the changes to Operation Holiday Joy as we explore this season of hope.
ABC 10 News at 6 starts now.
It could be just days before San Diego's frontline healthcare workers start getting their COVID-19 vaccinations. All of the vaccine needs is now FDA approval, and doses could arrive in the county as early as next week. ABC 10 News reporter Jennifer De La Cruz shows us the timeline for distribution and who else will get it first.
Hope is on the horizon in the nation's fight against COVID-19. The state of California is on track to receive 327,000 doses of the Pfizer vaccine if it's approved by the FDA. About 28,000 of those will go to San Diego County, and they're expected as soon as next week. Initial doses will go to healthcare workers and residents at long-term care facilities. UCSD says they'll start vaccinations for healthcare workers as soon as their doses arrive. Dr. Wilma Wooten says the second round of doses could be 3 to 4 weeks away.
Once the vaccines are available, we will let you know when individuals in other categories that are not in acute care hospital category, we will let you know when the vaccines will be available for you.
The need for the vaccine has never been greater, with cases, hospitalizations, and ICU hospitalizations on the rise. Palomar Health CEO Diane Hansen says those metrics simply aren't sustainable.
You know, while we can operate at 85, 90, 95% capacity for the short term, we can't do that for an extended period of time.
With a more restrictive stay-at-home order in effect since Monday, Supervisor Nathan Fletcher is urging for patience.
Simple reality is when you have as many cases as we have and it's spreading as fast as it is, there are very few settings that are safe.
Jennifer De La Cruz, ABC 10 News.
That second round of Pfizer vaccines would arrive around the same time that Governor Newsom expects to see the doses from Moderna. This afternoon, he announced the state would get about 672,000 of those doses. The county's 14-day rolling average for positive cases is now just shy of 7.5%. That is the highest we've seen. And you can see here, it has been steadily climbing since early November. There were more than 2,100 new cases reported today, bringing our total to 97,549. The county also reported that 15 more people have died, and more than 1,100 San Diegans have died from the virus. With ICU beds running short, hospitals are trying to care for their COVID patients as efficiently as possible using everything that they have learned over the past 9 months. ABC 10 News anchor Derek Stahl is going in depth to explain the improvements in methods and medications, giving our healthcare workers a fighting chance.
Right now, hospitals just can't keep up with the surge of COVID-19 patients. And that's even more striking when you consider this. Hospitals have gotten better at treating COVID-19 patients over time and getting them out the door faster. In the beginning of the pandemic, in March, Sharp Healthcare says the average stay for a COVID-19 patient in the hospital was 12 days. As of last month, Sharp says the average stay dropped to just 5.3 days.
I think there's 3 big factors primarily.
Sharp Memorial Hospital Chief Medical Officer Dr. Tom Laurie says one factor has to do with better medications. COVID-19 patients now get 3 drugs: remdesivir to fight the virus, a powerful steroid called dexamethasone to prevent the immune system from going haywire, and medications like heparin to reduce blood clotting. On top of that, he says hospitals have improved techniques like when to use ventilators.
Initially, we were in this conundrum where we weren't sure whether we should intubate patients early or whether we should wait a little later. Over the last several months, we've figured out a really good progression.
That progression now starts with a surprisingly simple technique called proning. Doctors around the country discovered they could turn COVID-19 patients onto their stomachs, and it rapidly improves their breathing.
Oxygen therapy is an extremely powerful drug, if you like.
The technique has its roots in research from the 1960s by an emeritus professor at UC San Diego named John B. West. Studies have found proning can keep COVID patients off ventilators.
By putting people on their stomach in these positions and by proning them, you allow blood to get where the air is, and therefore you get better oxygenation. And it makes the oxygen levels better, it makes their work of breathing better, it makes them feel better generally.
Dr. Laurie says there are also two outside factors contributing to shorter hospital stays. The patients that are showing up now tend to be younger than early on in the pandemic, and that makes them more likely to respond well to treatment. And there's evidence the virus has mutated over time, possibly making it more contagious but slightly less severe. Derek Stahl, ABC 10 News.
And 2 Navy hospitals in San Diego will help to administer and distribute the COVID-19 vaccine. Today, the Department of Defense said those are the Naval Medical Center in Balboa Park and the Naval Hospital at Camp Pendleton. The DoD's initial supply of the vaccine, about 43,000 doses, will go to uniformed service members, whether active or reserve or retired. The UK has already started administering its share of the Pfizer vaccine. Canada approved its use today. The U.S. is expected to follow before the week is out. Some classes at San Diego State will be held in person when the spring semester begins in January. The university says that students who have those classes will spend the first 2 weeks of the term learning virtually while they get tested for COVID. This decision comes after a coronavirus outbreak among students marred the school's return to campus back in the fall. And cases ballooned to more than 1,000 by the end of September. The university has since implemented changes that appear to have reignited the outbreak. And the CSU system, which includes San Diego State, also announced today that it anticipates holding the majority of its classes next fall in person. With COVID cases surging, Stater Brothers Markets has agreed to give its employees hazard pay. Our partners at KPBS report the agreement with United Food and Commercial Workers calls for a $2 bump per hour. It will cover the company's employees for the next 3 weeks. While many companies offered hazard pay when the pandemic began, few have kept it up.
Kroger, which is Ralph's Food for Less, they are not doing it. They were the first company to pull out from doing it. We've asked them continually to please reinstate the hazard pay. Albertsons Vons has given their workers a bonus, basically a $5 an hour bonus averaged over a week's worth of pay, which is something. It's something, and I recognize that, but they can do more too.
Trader Joe's, whose employees are not in the union, has also given employees hazard pay, which it says will stay in place until next March. You can keep up with the latest coronavirus developments using the free ABC 10 News app. You can find that app in the App Store or Google Play. A security guard is okay after crashing his work vehicle over a water valve, sending a geyser into the air this morning. Well, the driver also took out a street light on Grossmont Boulevard in La Mesa, leading to fears the exposed wiring may have electrified the water. Fire crews waited for a team from SDG&E to cut the power before taking care of the water. San Diego police are looking into what caused the driver to crash. Starting next year, the county will further regulate the sale of tobacco. The Board of Supervisors approved the new ordinance this week. It will ban businesses in unincorporated parts of the county from selling tobacco to anyone under 21. It will also prohibit tobacco vending machines, establish a licensing program for businesses that want to sell tobacco. The new regulations are set to take effect next July. Qualcomm debuted a new smart campus at its San Diego headquarters today to show off its new suite of services that it plans to offer to cities. The services are designed to streamline processes from street signage to parking. Qualcomm also highlights its smart street lights that can monitor pollution levels and provide Wi-Fi.
So this becomes a Wi-Fi hotspot. So then you can use these lights in low to middle income groups housing, and these lights could then offer serve as a Wi-Fi hotspots towards those residential streets or those apartment complexes in those areas.
Qualcomm says it's approached the city of El Cajon with a proposal to build a 5G smart city network.